Human Metapneumovirus, or HMPV for short, is a sneaky germ that can make us sick. This virus is part of a larger group of viruses that are known to cause respiratory infections in humans. It can be particularly tricky because it shares symptoms with many other respiratory illnesses, making it hard to diagnose without specific tests. It's a relatively new discovery, first identified in 2001. Before its discovery, many cases of respiratory illness were attributed to unknown causes. The identification of HMPV has helped scientists better understand the landscape of respiratory viruses and how they affect human health. HMPV is a respiratory virus, meaning it primarily affects our lungs and airways. When someone is infected, the virus targets the cells lining the respiratory tract, leading to symptoms such as coughing, wheezing, and difficulty breathing. In severe cases, it can lead to pneumonia or bronchiolitis, especially in vulnerable populations. It's part of a family of viruses called Paramyxoviridae, which also includes the viruses that cause measles and mumps. This family of viruses is known for its ability to spread easily and cause significant illness, particularly in children and immunocompromised individuals. HMPV is a common virus, especially among young children. Children are often exposed to the virus in daycare centers, schools, and playgrounds, where close contact with others facilitates the spread of the virus. Symptoms in children can range from mild cold-like symptoms to more severe respiratory issues. Most children will have been infected with HMPV by the time they reach the age of 5. This early exposure often helps build immunity, but it doesn't guarantee that they won't get infected again. Reinfections can occur, although they are usually less severe than the initial infection. However, adults can get infected too, and the virus can sometimes cause serious complications, particularly in older adults and people with weakened immune systems. For these individuals, HMPV can lead to severe respiratory distress, requiring hospitalization and intensive care. The virus spreads easily from person to person, primarily through respiratory droplets released when an infected person coughs or sneezes. These droplets can travel through the air and be inhaled by others, leading to new infections. It's important to cover your mouth and nose when coughing or sneezing to prevent the spread of the virus. You can also get infected by touching a surface contaminated with the virus, and then touching your nose or mouth. Common surfaces like doorknobs, light switches, and mobile phones can harbor the virus, making it crucial to practice good hand hygiene. Regularly washing your hands with soap and water or using hand sanitizer can reduce the risk of infection. While most people recover from HMPV without any lasting problems, it's essential to be aware of this virus and take steps to prevent its spread. Simple measures like staying home when you're sick, wearing a mask in crowded places, and maintaining good respiratory hygiene can make a big difference in controlling the spread of HMPV. Knowing the symptoms and how it's transmitted can help us protect ourselves and those around us. By staying informed and practicing good hygiene, we can reduce the impact of HMPV and keep our communities healthier. HMPV is highly contagious and spreads easily through close contact with infected individuals. This means that everyday interactions, such as shaking hands, hugging, or even just standing close to someone, can facilitate the transmission of the virus. It's important to understand how easily this virus can move from one person to another, especially in environments where people are in close proximity. It's primarily transmitted through respiratory droplets expelled from the nose and mouth during coughing or sneezing. These droplets are tiny particles that can carry the virus and are released into the air whenever an infected person coughs or sneezes. The droplets can linger in the air for a short period before settling on surfaces or being inhaled by others. Imagine these droplets as tiny, invisible missiles carrying the virus. They are propelled outwards with force and can travel a considerable distance before falling. This visualization helps us understand the importance of covering our mouths and noses when we cough or sneeze, as it can significantly reduce the spread of these infectious droplets. When an infected person coughs or sneezes near you, these droplets can land directly in your nose or mouth or even be inhaled into your lungs. This direct transmission is one of the most common ways the virus spreads, making it crucial to maintain a safe distance from those who are visibly ill. You don't have to be standing right next to someone to be at risk. These droplets can travel up to 6 feet. This is why social distancing measures are recommended during outbreaks of respiratory illnesses. By keeping a safe distance, you reduce the likelihood of coming into contact with these infectious droplets. But it's not just about airborne transmission. The virus can also spread through indirect contact, which is another significant mode of transmission. HMPV can also spread through indirect contact. This happens when an infected person touches their nose or mouth and then touches a surface like a doorknob, toy, or phone. These surfaces can become contaminated with the virus, posing a risk to anyone who touches them afterward. This happens when an infected person touches their nose or mouth and then touches a surface like a doorknob, toy, or phone. The virus can live on these surfaces for a period of time, and if you touch the contaminated surface and then touch your face, you can become infected. This is why hand hygiene is so important. The virus can live on these surfaces for a period of time, and if you touch the contaminated surface and then touch your face, you can become infected. Regularly cleaning and disinfecting commonly touched surfaces can help reduce the risk of indirect transmission. Outbreaks of HMPV are common, particularly in the winter and spring months. During these times, people tend to spend more time indoors in close quarters, which can facilitate the spread of the virus. The colder weather can also weaken the immune system, making individuals more susceptible to infections. This is similar to the flu season, and in fact, HMPV infections often occur at the same time as flu outbreaks. The symptoms of HMPV can be similar to those of the flu, including fever, cough, and difficulty breathing, which can make it challenging to distinguish between the two without proper testing. Crowded settings like schools and daycare centers can facilitate the rapid spread of the virus. Children in particular are more susceptible to HMPV and can easily transmit the virus to their peers and family members. Ensuring good hygiene practices and keeping sick children at home can help mitigate the spread in these environments. To protect yourself and others from HMPV, it's essential to practice good hygiene. This includes washing your hands regularly with soap and water, using hand sanitizer when soap and water are not available, and cleaning and disinfecting frequently touched surfaces. By taking these precautions, you can help reduce the spread of the virus and keep yourself and your community healthy. HMPV can be tricky because its symptoms often mimic those of the common cold. This can make it difficult to distinguish from other respiratory infections without proper testing. In most cases, HMPV causes mild cold-like symptoms. The most common symptoms include runny nose, cough, sore throat, fever, and wheezing. These symptoms typically appear within 3 to 6 days after exposure to the virus. In most healthy individuals, the illness resolves on its own within a week or two. However, HMPV can be more serious in infants, older adults, and individuals with weakened immune systems. In these groups, HMPV can lead to more severe respiratory complications such as bronchiolitis, which is inflammation of the small airways in the lungs, pneumonia, which is an infection of the lungs, and respiratory failure, which is difficulty breathing requiring oxygen support. If you or someone you know experiences difficulty breathing, persistent high fever, or worsening symptoms, it's crucial to seek medical attention immediately. Once HMPV enters your body, it targets the cells lining your respiratory tract. This virus, known as human metapneumovirus, is a common cause of respiratory infections, especially in children, the elderly, and those with weakened immune systems. It spreads through respiratory droplets when an infected person coughs or sneezes, making it highly contagious. These cells found in your nose, throat, and lungs are responsible for protecting your airways and keeping them functioning properly. They act as a barrier against pathogens and help filter the air you breathe. When HMPV infects these cells, it disrupts their normal function, making it easier for the virus to spread and cause symptoms. The virus invades these cells and hijacks their machinery to replicate, creating more copies of itself. This replication process is rapid and efficient, allowing the virus to quickly establish itself within the respiratory tract. As the virus multiplies, it damages the infected cells, leading to the symptoms of the infection. This invasion and replication process triggers your body's immune system to fight back. The immune system is your body's defense mechanism against infections, and it responds by sending white blood cells to the site of infection. These cells work to identify and destroy the virus, but this battle can also cause collateral damage to your own tissues. Your immune system releases cells and chemicals to attack the virus and infected cells, leading to inflammation in the airways. Inflammation is a natural part of the immune response, but it can cause swelling and irritation in the affected tissues. This is why you may experience symptoms like a sore throat, runny nose, and cough. This inflammation is what causes many of the symptoms associated with HMPV infection. The body's attempt to clear the virus results in increased mucus production, which can clog the airways and make breathing more difficult. This is particularly problematic for young children and the elderly, who may have smaller or less resilient airways. The inflammation causes swelling and mucus production in the airways, leading to a runny nose, cough, and sore throat. These symptoms are your body's way of trying to expel the virus and clear the infection. However, they can also be quite uncomfortable and may persist for several days to weeks. In more severe cases, the inflammation can spread to the smaller airways in the lungs, causing bronchiolitis. Bronchiolitis is a condition where the small airways, called bronchioles, become inflamed and filled with mucus, making it difficult for air to flow in and out of the lungs. This can lead to wheezing, shortness of breath, and difficulty breathing. This can make it difficult for air to move in and out of the lungs, leading to wheezing and shortness of breath. In severe cases, the lack of oxygen can cause fatigue, cyanosis, a bluish tint to the skin, and even respiratory failure if not treated promptly. It's important to seek medical attention if you or someone you know is experiencing severe breathing difficulties. In some individuals, particularly those with weakened immune systems, HMPV can also lead to pneumonia, a more serious infection of the lungs. Pneumonia occurs when the infection spreads to the alveoli, the tiny air sacs in the lungs where gas exchange occurs. This can cause the alveoli to fill with fluid or pus, making it difficult to breathe and reducing the amount of oxygen that reaches the bloodstream. Pneumonia occurs when the air sacs in the lungs become filled with fluid, making it difficult to breathe. Symptoms of pneumonia can include a high fever, chills, chest pain, and a persistent cough that produces phlegm. In severe cases, pneumonia can be life-threatening, especially for the elderly, infants, and those with chronic health conditions. Early diagnosis and treatment are crucial to managing the infection and preventing complications.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.